My name's Stefanie Edson. I'm a nurse practitioner in the emergency department at the Royal Hobart Hospital. As the state representative for the ACNP, I am the secretary for the Tasmanian chair. My role is to support the chair position in all secretary involvement, including documentation, event organisation, and communicating with members. Some of the turning points in my career have included working through the Northern Territory and in South Australia prior to coming to Tasmania. Early in my career, I wanted to be a retrieval nurse, and finally I found out that the environment in the Northern Territory on a plane wasn't quite my position of comfort. Coming to Tasmania was a climate change which actually turned out to be a lifestyle change, including my role here at the Royal Hobart Hospital. Originally, I was a nurse on the floor in the emergency department. I moved my way through to resus, triage, and finally into an after-hours role upstairs in the main hospital. To get credentialed, I needed to complete my emergency department training. In addition to that, I did a graduate certificate and a graduate diploma and my Masters of Nurse Practitioner. In addition to this, I did a nurse practitioner candidacy directly here in our emergency department, which was supported by the Alfred Hospital. Being a nurse practitioner is really special in the fact that you're not a doctor and you're not quite a nurse anymore either. Instead, you're an autonomous member of the multidisciplinary team. You can actually make significant impact to both the training of other nurses, junior doctors, supporting senior doctors, as well as making change to patients' journey through the department and into the hospital area. I really enjoy that autonomy and being able to make decisions and assist people through that journey. I've been really fortunate in some of the projects that have come across my desk in the fact that we are redeveloping the Royal Hobart Hospital, and as I've been a part of management and also a clinical nurse, I have been able to make suggestions and improvements that will affect both the patients and staff satisfaction of the area that we work in. In addition to that, I was successful to get a scholarship to the Australian College of Nursing, where I got to go to Greece and Turkey to learn more about cultural healthcare and the way they do things in other countries. I moved to Hobart primarily for the climate originally. I came down here for 6 months to climatise before moving to Canada, and I fell in love with the city and the hospital and the department. The Royal Hobart Emergency Department is a very collaborative and pleasant place to work. The physios, the allied health, the doctors, the nurses, the nurse practitioners, we all work together in a multidisciplinary team, creating a really great environment to work and live. I assist with education and support of junior staff, and I also do advanced nursing skills that are beyond the general advanced nursing skill process here at the Royal. I prescribe, I see patients autonomously, and I provide education services for the general staff. As a nurse practitioner, we've only been around for the last 20 to 25 years, so it's really an exciting pioneering role that we have here in the emergency department. I believe at the moment there's only about 2,500 nurse practitioners in Australia, so we have a really good opportunity to open this up and provide better care for the community as nurse practitioners. Some of the trends that I'm seeing is that patients are really demanding individualised care that's dynamic, efficient, and affordable. And quite often as emergency care providers, that we're seen as those places that people can come and basically get a one-stop fits all care placement. And that's where nurse practitioners are excellent in providing that care, because we have the clinical and holistic knowledge to be able to assist the greater multidisciplinary team to ensure the patients get the best possible outcome from our department. When people are looking at becoming a nurse practitioner, I highly recommend people be patient, be kind to themselves, and have lots of self-care. It is a long journey, but it's worth it. The university is hard. The roles that we require to learn whilst we're a nurse practitioner are difficult, but the journey is worth it. The passion in my job comes from the people that I work with. I'm very fortunate that I get to work with a broad scope of staff, including primary care physios, paramedics, allied health, nurses, doctors, and of course our patients. So my passion comes from seeing them every day and being able to make a change in both people's professional lives and the patient journeys that we have here in emergency. Outside of work, I like to holiday in Canada and Japan and go snowboarding. I also like to go jet skiing because Hobart is a beautiful place with plenty of water around, and any chance to be outside is amazing.